What's brown and sounds like a bell? Dong. Why did the dust bunny fall in love with a Roomba? It was swept off its feet. What do you call a muddy chicken that crosses the road twice? A dirty double-crosser.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve! Yo, take a cowboy. Do the vertebrae.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott. The traditional Chinese medicine provider gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And also in the studio, we have my wife, Tacie. She's quite delightful. Hello, Tacie.
Well, hello.
Well, hello.
Hello.
This is a show for people who've never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to your regular medical provider, can't find an answer anywhere else, give us a call, 347-766-4323. That's 347. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website, drsteve.com, for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, massage therapist, or whatever. Okay, massage therapist is new. Someone emailed me and said, can you add massage therapist to the list? And it's like, yeah, cool, whatever. Don't forget to check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. He's got CBD nasal spray in stock. You getting any orders? Is it flying off the shelves? It should be.
It is, yeah.
Is it?
Yeah, it's been. We've
you make any money doing something like that?
Not much, but
I mean,
better than
enough to.
Well, to cover costs for sure.
Well, yeah. Well, I mean, enough to go on vacation at the end of the year.
Oh no.
I know your enterprises sound like mine.
Not even if you fly Allegiant.
No, maybe, but not that much. No. Yeah, well, I wouldn't mind a trip to
send Dr. Scott on vacation. Go to simplyherbals.net and buy some of his malarkey, and help Tacie in retirement. Patreon.com/weirdmedicine. And we're doing some regular shows, Tacie and I, and then we'll have guests from time to time. We've had Robert Kelly and Mark Normand. And when we have a celebrity on, we'll do a thing called the exam room where they just get to ask us questions. So we'll talk more about that later. And please don't forget stuff.drsteve.com, stuff.drsteve.com for all of your online shopping needs. Apparently they've accepted never sent me an email saying, hey, thanks for sending the email. We agree you're doing okay. You're not breaking any of our rules. Nothing. They just haven't canceled us yet.
That's cool.
So there you go. All right. By God, I am shot out of a cannon today. I've been working on administrative stuff all day. Let me just ask you this, Dr. Scott. Okay. I want to see if you're smarter than
I wouldn't count on it.
An administrator. Okay, so if you graph the number of storks in Norway. Okay, stork population in Norway over time.
Okay.
And you see the stork population increasing over time. And then you graph the birth rate of Norway over time. And you see the birth rate increasing over time. Would you make the conclusion from that that the increased stork population is somehow contributing to the increase in the birth rate?
I'd say absolutely.
Yeah, in other words, that the storks are bringing these babies to people's houses. Would you make that assumption?
That'd be a stretch, but I'm going to say no.
Okay, thank you.
Yeah,
that's all. Give
yourself a bill.
You are smarter than some people that I work
That's right.
with.
That's right.
That have some measure of control over my life.
Hey, I appreciate.
That's all I'm going to say.
Hey, I appreciate you putting the bar so low I can trip over it. Since
Right.
it's the first question.
Thank
of the
you.
Day,
Well,
yes.
that's the thing. It's
not
rocket science.
it's not that tough.
Correlation is not the same thing as causation.
Right.
Period. I can't
Covered
say
it.
anymore.
We've
but-
covered it for 15
yes,
years.
and our audience is incredibly sophisticated.
Yes.
Really is. The people who have listened to us this whole time,
Agreed.
They'll start quoting to me, well, that's not a double-blind, placebo-controlled study. That's not, grade A evidence and stuff like that. I'm very impressed.
Yep.
And it's not only that. They know lots of stuff.
Yep.
They know the anatomy of the testicle pretty well because every October we go over it. And, they know some critical thinking that isn't out there. And so I'm very impressed with our audience.
Yeah, they are great.
And yes, anyone who's listened to this show for any period of time would have been able to just say, yeah, correlation and causation aren't the same thing.
They're not.
So, all right.
No, they aren't.
All right. That's enough of that. Anyway, you have some... God. I cannot wait to retire.
It's pretty good.
Yeah.
I like it.
Yeah. How's retirement going, Tacie?
It's fabulous.
Yeah, tell us about it. What's your day like?
Oh, God, here we go.
I'm just so busy.
Get your seatbelt on. It's going to be a bumpy ride.
I get up around 8 because the dogs, but then or earlier, usually 7 to 8.
Well, if our youngest is home,
he wakes me up going out the door.
Yeah, but he lets the dogs out, so we don't even have to get up. This damn kid is so self-sufficient. And everybody talks about their kid. Oh, they're the greatest kid in the world.
We've never had one like that before.
It's true. We have two, and they're both delightful, but they're very different. And Beck is very self-sufficient, probably because his brother required so much attention.
So much.
That he just had to, I guess I'm on my own here. But his alarm goes off at 6. It goes off again at 6:10. He gets his ass up. He takes a shower. I'm not in there going, back, get up.
Come on, man.
Unlike a different person that we had. And then he gets up, gets it. I'll set out some stuff for him to eat the night before. I boiled eggs for him last night. Obviously, I put those in the refrigerator. I'm not a complete idiot. And but he makes himself some breakfast. He lets the dogs out. He feeds them. He lets them back in. Locks everything up. Gets his euphonium and drives himself to school. And it's like, hell yeah, dude.
It's lovely.
It is lovely. It's also nice to be needed by your kid, but he needs us for money. But he doesn't need much else.
Then the dogs come running upstairs and jump on the bed because they think it's playtime.
Right. Well,
Yep. That's funny.
Yep. So I'm getting called. Someone at work must be listening because now they're calling. But what did you say about me?
We're busy. We're solving all the world's
So let's
problems.
get back to my busy life.
Let's get back to
Yes.
retirement.
So anyway, the dogs jump on the bed
So
at 7:00 and they wake you up licking you in
generally
the face.
I get up
This
and
sounds
watch
horrible, by the
and
way.
I watch the Today Show for a couple of hours and drink coffee.
Oh, how can you watch that?
Then I'll.
Is that before the wine or after?
No,
No, she doesn't start.
I've not been drinking during the week.
Oh, okay. Well, there
Yeah,
you go.
and so then, I make myself get up and take a shower because people expect you to wear pants.
Yes, pants are important.
The world's full of just assholes.
Judging your...
God damn, this is about as boring.
I know it is, but I don't care. This is my new life. So.
Can you please stop bullshitting and get to the question?
And then there's usually a midday nap and 90 Day Fiance, shows like that.
90 Day
HGTV,
Shit Show.
TLC, shows about fat people, which is definitely where I'm headed. I watched 3 movies yesterday. That was pretty good.
Who is it that we know that's into 90 Day Fiance that you're going to have on the show?
Oh, you said...
who is it?
Jimmy Norton?
Oh, yeah, that's right. Yeah, Jimmy. Yeah. So Jim's going to be on our Patreon show with us, and rather than do the regular exam room format, which is where the comedian or celebrity asks us medical questions, we let them just ask many medical or science questions they want to ask. It's kind of a fun format.
Yep.
Tacie and Jim are going to talk about 90 Day Fiance.
Yeah.
Okay, so after you figure out what who are the people on 90 Day Fiance now?
Well, I mean, it's
just give us the.
There's a bunch of people. There's one guy who won't take his hat off because he's got this weird hair pattern. There's only hair patch in the back, and not.
That's the one that gave he went to Peru and he's got a hot girlfriend, right?
And she's psycho crazy.
Well, he's making her psycho crazy.
No. This girl.
Do you think she was crazy before? Well,
I mean, yeah.
Okay. Allegedly,
I'm sorry, but I know it when I see it.
Okay.
And
so
and then,
she has a different reaction to stimuli than you do. But didn't he give her an electric toothbrush
for Christmas?
Come on. What?
And she got mad at him and threw it outside. But then he
sure.
went and retrieved it in case they got back together, which they did.
But
so
then did she want
she
wanted the toothbrush back?
Yeah, she has it back.
I mean, didn't he give that to her because he thinks in Peru they don't brush their teeth or something?
No, I don't know why. He found her fingernail and he wanted to keep something of her and he kept it.
Okay, I'm gonna interrupt here. I'm gonna interrupt it.
Well, that's because you're an idiot.
This show is fabulous, and these people who don't
here.
watch it, I don't understand. They just don't know what they're missing.
So, years ago, speaking of buying an electric toothbrush. Right?
Okay.
Years ago, my ex-wife, who have heard me.
Pull your mic closer because I really want to hear this.
Yeah, I've been bitching about her for the last 15 years or so.
Yeah.
If it wasn't for her, I'd be like Tacie, retired too. But anyway. Yeah, so she was bitching and raising hell.
My ex got my retirement before I had much in it.
Oh, that's good.
Yeah, she got a half of it. But anyway, go ahead.
Oh, man. So she was bitching and complaining because the floors are always dirty. And I said, well, listen, we've got 3 dogs and me bringing dirt into here, and it's not real difficult to clean it up. So I thought,
there is a protocol for cleaning floors.
It's not difficult, but bitching about it doesn't fix it. Right. So
that always helps when I say that.
Yeah, I don't like to bitch about it. I like to do something. So for her, I bought her I bought her the Roomba.
No. Oh,
yes.
Okay. Well,
I bought a Roomba. Yeah, I bought a Roomba because I said, listen, we can put this, we can program it. It was like $500. It's the nicest one they made at the time.
Right.
She pitched the biggest fit.
Yeah.
She sent that fucking thing back.
You weren't reading the room on that one.
Dude, she sent it back and kept the money.
Well, okay.
That's not good. No, it's not good. You can't tell me that's acceptable. You can't tell me that's not cool.
Oh, no. If someone returns a gift and they get the money.
Here's the issue with me and the Roomba.
Yeah. She wanted one.
I'm going to have to start cleaning, I think. And the problem with that is I don't even know if we have a vacuum cleaner. So I may need one.
I know. I've seen 3 of them.
No, I'm serious.
I've seen at least 3 downstairs.
We have 3.
I've seen at least 3.
At least 3.
I've seen.
I know
3.
we've got the shark,
right
but that's
now.
little.
No,
I mean, I'm talking
we
something.
We have an Electrolux. We got all kinds of.
We're going to have to.
Oh my God.
Buy supplies and things like it because I don't know where any of that shit is.
Okay.
So
now, Tacie got a Roomba for Christmas, but she asked for it. She said, "I would like to have one of those."
Well, I mean,
it's a different. We had a friend who gave his wife a scale for Christmas.
That would not be a good call. But I thought I was helping. I thought I was making a positive.
You're not supposed to help at Christmas.
I remember that, but I don't remember who it was.
He used to be on this show a lot.
Okay.
and he's an attorney.
Oh God.
Was this his ex-wife? He bought one for her.
Yeah.
Oh.
Not the current wife.
So, if you had bought that for her a week before Christmas and then given her a Christmas present, you probably would have been a hero.
I remember him defending that it had all the bells and whistles.
Yes, I thought I was doing good.
Yeah. Well, so the other person did about the scale too.
Oh,
you can graph your weight over that.
Yeah, no. That's what he was saying. Yeah, you can.
Now, I may be dumb, but I ain't stupid. That's stupid.
Yeah,
that is stupid.
But no, if you give somebody a gift and they return it, they get to keep the money. That's just how that works. Yeah.
Yeah.
I'll remember that, Dr. Steve.
So I really just recommend 90 Day Fiancé for everyone.
Well, there you go.
We're doing marital advice. Don't give your wife an appliance, any kind of thing that implies that it's her job.
That's useful
to do something.
Yeah.
And when you watch it, you think you see these shit shows, and then you're like, you know what? We don't have it that bad.
Yeah.
No.
Yeah.
That's a good one. The other thing is, don't give if you're just meeting your girlfriend for the first time, don't give her deodorant. I'm talking at you, Big Ed, or a toothbrush. And making some implication about somebody's hygiene, for God's sake.
Or a razor,
I mean,
mouthwash.
That's why these people are on those shows, though, because they're just clueless about how to interact with human beings.
It's wonderful.
If there'd be at least one couple that was sort of functional, that was interesting. And now it just seems like it's just one dysfunctional lunatic after another.
Mm-hmm.
But anyway, all right.
So enough about that.
Yeah.
That's unbelievable. So that's your retired.
Oh no, wait. So that's
retired life.
We haven't even gotten to 1 p.m. yet. So tell us.
That's nap time.
Okay. Oh, okay. Okay.
And then just my TV shows. Like that's the 3 movies I watched yesterday, and yeah.
It sounds
delightful. It does sound delightful, and you're just very newly retired.
Yes.
I mean, it's not like you didn't work your ass off since you were, 18.
16.
And you're older than you look, so that's the other thing. People look at you and they go, "Oh, Nana, she's so young."
Is that good or bad?
No, you.
No.
Okay, you
is that
look
the right
younger.
way or the wrong way?
You look younger than you are, is what I should have said.
Okay, yeah, okay.
There you go.
But people look at you and go, "Oh no, she's only 28, and how is she retired?
That's bullshit,
she must have
anyway.
it easy."
Oh, I'm cussing a lot. Oh, my new retired life, I cuss a lot, I guess.
Yep. Well, you don't have to worry about your boss hearing you anymore. Anyway.
Oh my God, that's hilarious.
Yeah, I'm sure we're boring people to tears.
Sorry.
No,
guys.
you're not. It's me. So, all right. So then what's the rest of your day? Then I come home, and then what?
Then we eat and we watch more TV.
That's some life.
That is an awesome. I want to try it, man. I'm thinking I could handle it.
It's really nice, and people want me to go places, and I'm like.
And you're going.
And you are going.
No, not really.
No. Oh, come on.
She's been on more vacations in the last 3
Chanda
years.
said,
vacations
let's go.
are one thing, but like to Walmart or Target.
Oh.
I still buy stuff online.
Oh yeah,
I don't want to get out of the house.
No,
like they make you wear pants.
If you want to go somewhere,
Yeah.
Awesome.
Yeah, awesome.
Okay.
Anyway, I love it.
All right, that's what retirement looks like, everybody. I wonder. I mean, you're newly retired, so this is new. I think you'll probably get into a different new normal down the road, but we'll see. Where you're doing. I don't know.
She seems pretty happy.
Yeah.
Will you be disappointed if I just turns out I'm just lazy?
No, I won't.
Maybe
good.
Maybe one of these days he'll be lazy with you. That would be nice.
Yeah. Oh, it would be.
That would be nice. I wouldn't count on it though.
All right.
He's crazier than I am. And that's trouble.
Yeah, he'd just stay up here the whole time.
Yeah, that's true. I got a ham radio in the other room, and then the music studio's right next door to it, and we're right here. So what else would I need to do? All right. Anyway, enough. What do you got, Dr. Scott?
Well, kind of piggybacking on what she was talking about a little while ago with...
please don't do that. I just can't.
So I figured out if we would have had this article
at
the beginning of COVID 2 years ago, COVID would have lasted for a week or two.
Okay.
Max.
Well, I had the solution to ending it in a week.
Oh, yeah. What was that?
Put everybody in a bubble.
Oh, yeah.
It would take longer than
home.
a week. It would take 14 days.
Stay at home for 14 days.
Well, just everybody's in a bubble. You don't touch anybody.
Yep. I think it'd be reasonable.
No, it's idiotic, but there's nothing in the laws of physics that says that you couldn't do it. It just would be very impractical, but it would have ended it immediately. Also, probably end every other viral issue that we have.
Yep. Just tell everybody to go to the store, get what they need for the next 2 weeks.
Well, you would have to have 7 billion big giant rubber bubbles that people would live in.
What about it, instead of just staying at the house and not leaving your apartment or house for 2 weeks?
Well, we tried that 2 weeks to flatten the curve bullshit.
Yeah, that was kind of nice though.
Well, it wasn't just now it's 2 years to not do anything.
Yeah.
And still do all the same things, but not accomplish very much.
That's kind of like sounds like the life of a retired person.
It does. Well, thankfully, if you go to covid.stoutlabs.com, he's got it set now so that the first thing that comes up is the United States, and it's looking pretty damn good right now.
Yeah, that's a good thing.
Yeah,
just keep it up.
Yeah.
So your solution was put everybody in a bubble.
Keep it up. It's just nature doing it. We're not doing anything to affect it very much.
It doesn't seem to be anyway.
I mean, therapeutics and vaccines, of course.
Of course, yeah.
But
outside that. Well, good. So here's my solution.
Okay.
If we would have had this research, we'd be over with COVID instantly.
Okay.
So here's the article. COVID-19 can infect penis and testicle cells, potentially causing erectile dysfunction, study finds.
Ooh.
That's right.
Really?
Yep. So what they're saying is men who contracted COVID-19 3 times more likely to develop erectile dysfunction. Yep. And they're finding the virus goes into the testicles and the penis. Both can cause erectile dysfunction, like a Peyronie's disease.
What?
Causes swelling in the cells in the testicles and penis. Can even cause you to become infertile. It affects the sperm if you get a bad.
They use the word orchitis in there. ORCHITIS. That's actual inflammation of the testicles. Right.
I didn't see that, but no, that's.
Hang on, I'm looking this shit.
But you are right.
That
is you are correct, sir.
Thank you.
Inflammation. So a study published last year by the University of Florida found that men who had recovered from the virus are 3 times more likely to develop the condition of erectile dysfunction than not. That's University of Florida. Now again, they are gators, so that's that is what it is. But
yeah, I don't know what that even means.
Well, we're Tennesseans. They're Florida Gators. That's all that means.
Okay,
and we'll leave it at that. So that I feel like if that article would have come out, all of the men would have paid attention and would have done anything they could do to keep from getting the virus.
Wow.
Just the fear of erectile dysfunction.
When you get this is not unheard of. When you get mumps as an adult, you can get orchiepididimitis.
Right, which is not comfortable.
No.
It hurts like
and it can do some bad things to you too. Here's some cases of case report by Gagliardi et al. Claimed that the first described case of orchiepididimitis with concurrent COVID-19 infection suggested that a testicular involvement could be expected in COVID-19 patients. In the way as has been reported to authors is somewhat misleading, as seemed to associate COVID-19 to that without any biologic data at that time. Now this was older. This was 2020. So what article are you looking at?
I've already moved on to the next one.
You son of a bitch.
No, but I'll go back. I was looking at the next one.
Let's look. Effect of COVID-19 on male reproductive system. A systematic review. This will be good.
Yeah, there you go.
Because this systematic review is a study where they take a bunch of data from a bunch of studies and mush it together and then look at it all. So they identified 28 related studies, only one of which reported the presence of COVID-19 virus in the semen. Study found semen quality of patients with moderate infection was lower than that of patients with mild infection and healthy controls. Wow. Impaired semen quality. Oh, this semen has a very poor quality. May be related to fever and inflammation. Pathologic analysis of the testis epididymis showed that SARS-CoV-2 viral particles were positive in 10 testicular samples. God, I'm not giving them a sample of my nuts after this, though. You know what they'd have to do that? Like a core biopsy or something? You know, they have to numb up, they have to prep your scrotum, and then they have to numb it up, and then they have to, and then numb it up, and then do an incision, identify the testicle, and then go in and actually take a core of the testicle out, and then look at it under the microscope.
I think if I knew they were going to be doing that to me, they'd have to find my testicles first. They'd be retracted.
Yeah, they'd be retracted. Pathologic analysis. Okay. Oh, I already said that. All 94 expressed prostatic secretion samples were negative for SARS-CoV-2 RNA. So that's interesting. So it wasn't getting into the prostate, but it was getting into the testicles. That's wild.
Isn't that crazy? Yep. Crazy.
Yeah. And then they were saying semen should rarely be regarded as a carrier of SARS-CoV-2 genetic material. However, COVID-19 may cause testicular spermatogenic dysfunction via immune or inflammatory reaction. So they were saying in this case, wasn't so much that the virus was infecting the testicles, but that the viral infection in other parts of the body was causing inflammation in the testicles. So, wow.
Isn't that wild?
So does the sperm work as well? Like, will the
Well,
outcome?
that's what they're saying. No, that's what they mean by
yeah.
quality.
Yeah.
I mean, I was being silly, trying to sound like the sommelier.
When you say
that was my
outcome-
sommelier voice, by the way. It wasn't trying to be anything.
Yeah,
other
I
than
didn't
that.
like that voice.
Okay.
So when you the outcome of a baby's born.
Yes. Now listen to this. They say long-term follow-up is needed for COVID-19 male patients and fetuses conceived during the father's infection period. So they don't know. They don't have any data on that yet. So I'll tell you one thing, though. When I had COVID-19, the last thing I was thinking about was, strutting my stuff and getting it on and getting somebody pregnant, particularly Tacie.
Oh, well, that'd have been trouble.
So I don't know how many.
Particularly Tacie.
Well, I'm just
particularly. That's right.
In the sense that you're the only person I would actually have intercourse with.
Mm-hmm.
That it didn't sound right.
No, it didn't.
I'll give myself.
You get nothing.
That's pretty much.
You're going to get nothing.
But I didn't.
Sums it up.
But what I meant was I wasn't thinking of having sex with my wife, which is probably I should have just said that instead of trying to be clever. And
too late, sucker.
I know. And when I had COVID, so I would think that the number of people that had active infection with COVID-19, unless they were just asymptomatic, that got somebody pregnant while they were infected is probably pretty low. But when you're looking at hundreds of millions of cases, there will be some. So those will be interesting to follow. Anyway.
Cool.
Interesting.
Good stuff.
Last week you brought one of the best things that it is the best thing you ever brought. Mm-hmm. And I would like for you to bring more stuff like that. That was the birthing thing. That was fascinating.
That was pretty cool.
Yeah.
Yeah, it's incredible that there's so many crazy things out there that are really interesting.
I know.
Yeah, really interesing.
Yeah.
I'll start.
All right, what else you got?
I'll start my show prep before the show starts next week.
That was good. You could tell that you had.
I just don't have time, or I would.
Now here's something.
Yeah, Tacie doesn't have time to do any show prep.
Yeah. No, God bless her.
No, she has the time. She has none of the inclination, none whatsoever.
Now here's something.
Right?
Yep.
I'm right. That's right. Okay.
Now, Dr. Steve,
I'm going to have to check every time I say something and make sure I didn't say something stupid.
All right, Dr. Steve, I'm going to quiz you. Are you ready for this?
Yep, I'm ready.
Next topic.
Okay.
Does your height affect your odds for colon cancer? Yes or no?
Well, that's interesting. Well, the way you asked that, I'm going to have to say yes, but you wouldn't think so.
No.
Tell me.
You wouldn't think of it, but it does, yeah. So a new study, and I just saw this today. It was incredible. I didn't realize it. But so Johns Hopkins did a study of 47 international studies and included more than 280,000 cases of colorectal cancer. Excuse me, and 14,000 cases of precancerous colon polyps. And the findings suggest that the taller the individual is, the higher percentile they had of risk of.
That is amazing.
But listen to this. So this is the crazy part. So men 6'1" and older,
Yep,
taller.
I'm looking at that.
Yeah, and women 5'8" and tall and taller.
You don't have anything to worry about today.
Yeah, I do though. Hellfire, 14% increased risk of colon cancer.
Wow.
Yeah, isn't that wild?
And a 6% increased risk of adenomas.
Yep.
Which are,
the precancerous polyps.
Yep.
Okay, yeah.
Adenomas are, it's just, at that point, they're benign tumor derived of glandular tissue, though.
Okay.
And there's tons of glandular tissue in the colon.
Yeah.
So, wow.
Isn't that wild?
Okay, so, they said Eleanor Zhao with Johns Hopkins had a potential explanation for this link is that adult height correlates with body organ size. Okay, that makes sense.
Yeah, so more of it available to get
more
sick.
active proliferation in organs of taller people could increase the possibility of mutations leading to malignant transformation. So that is interesting.
Yep.
Someone who is larger, just has a larger body habit, it's not just fatter, but I mean just a larger person, is going to have a larger colon. A larger colon means more cells dividing, and more cells dividing means more risk for cancer. So that's amazing.
May I mention?
Never thought about that.
May I mention one thing to that too? And she mentions in here that I'm talking about taller athletes.
Yes.
And the other thing about
people with Marfan's too.
Well, yeah, and Marfan's. But the thing about taller athletes, if they are athletes, college athletes, professional athletes, you know what I see a lot of, and did it myself, was a lot of anti-inflammatories, Advils, and stuff while you're playing.
And that actually can help prevent colon cancer.
Well,
right?
I don't know. That's what I was asking you. I don't know because you see sometimes you'll see people that have taken way too many NSAIDs going to renal failure.
Right.
And I didn't know if that would.
No. Okay. So
I know it's a different mechanism, but
if you go beyond the pale with this stuff, you can cause renal insufficiency and GI bleeding with non-steroidal anti-inflammatory drugs, and that would be aspirin, Advil, which is ibuprofen, and naproxen, which is naproxen.
Yep.
But a large number of just looking at epidemiological studies show that non-steroidal anti-inflammatory drugs reduce the risk of colorectal cancer. And I know a lot of people who are on or who have this condition called familial polyposis. These are people who have to have a colonoscopy every year.
Oh, wow.
Because they have their colon is nothing but polyps. And they'll often put them on an anti-inflammatory medication. I have a friend who just takes aspirin every day, and his gastroenterologist told him to do that because he had this, and it might help reduce his risk of developing colon cancer. The use of aspirin for 5 years reduces the incidence and mortality due to colorectal cancer by 30 to 40% after 20 years of follow-up. Oh, no, wait. Wrong button. There we go. Sorry, they're right next to each other.
Isn't that funny?
That's amazing, isn't it?
Isn't that wild? Yep.
So it would be great. Well, then why don't we just put it in the water? Well, there's some risk to taking aspirin every day as well. For me, my doc is going between putting me back on aspirin and taking me off aspirin. Every week, it seems like a new study comes out. Well, for people over the age of 65 who take aspirin every day, they have an increased risk of stroke and GI bleeding, and that outweighs the decrease in mortality that they might find in a myocardial infarction or a heart infection or a heart attack. Sorry.
I know.
And so they go back and forth on that one, because otherwise I would just take it all the time.
Yeah. Well, I can't.
40% decrease.
Yeah.
That's a big deal.
It is. It's a huge deal.
So be short and take aspirin.
Yeah, but not on an empty stomach.
Right.
Hey.
Well, and obviously at your physician or healthcare provider's behest. Don't do it because we're just talking in general terms.
Yes.
Not making any long-term recommendations for anybody.
No. Hey, you wanted to get to that question that Mick KM had for us 2 weeks ago that I promised him we would get to today.
Yeah. What is it? Do we have an answer for him?
No, I don't. But I'm going to ask you.
Oh, Jesus. Okay.
I forgot to
You're putting me on the spot. It's okay.
Poor Mick. No, Mick asked this question 2 weeks ago, and I meant to get to it, and I never did. But he was asking, nicotine is considered to be the addictive ingredient in cigarettes.
That's correct.
But flavonoids released while burning tobacco have an MAOI effect. How much could they contribute to smoking addiction?
Wow.
That's a hell of a question, isn't it?
Yeah. I mean, okay, so let's talk about other things that have flavonoids in them.
Yeah.
These are polyphenolic. So these are phenols, are these sort of ring-like structures, and these are polyphenolic. So there's bunches of them together, plant compounds, and they occur in fruits, vegetables, chocolate, wine, stuff like that.
Right.
And Linus Pauling is real big on flavonoids. They were the Linus Pauling Institute. You can go there. It's at Oregon State University. They have a whole thing on micronutrients, and they are pushing. Let me see what they say. Biologic effects of flavonoids appear to be related to their ability to modulate a number of cell signaling cascades, and they've been shown to exhibit anti-inflammatory, anti-thrombogenic, so that's anti-blood clots, anti-diabetic, anti-cancer, and neuroprotective activities through different mechanisms of action. In vitro. And our audience knows that means in the test tube.
Mm-hmm.
But anyway, they've been doing some randomized controlled trials, and they think that flavin-3-ols may be beneficial for cardiovascular health. So I don't know. I've not seen flavonoids as a vector as a mediator of addiction. So I don't have an answer for him on that.
Yeah.
Let's look up flavonoids and addiction.
Okay.
Flavonoids and addiction. And I do this because it's not great radio, but
Nope.
just shut up.
Hey, but we're doing the work.
But
we're doing the
just
work.
showing how you find these answers rather than just coming up with the answer and sounding like genius.
Well, while you're doing that, you want to talk a little bit more about smoking addiction and the.
Yeah, absolutely.
So a lot, not only is it just certainly the chemical effect, which Dr. Steve can speak to in a minute, but a lot of it's behavioral. And when I used to, Dr. Steve used to smoke. Did you ever smoke, Tace?
Yes.
Oh God, did she?
Did you smoke like a freight train?
I mean, I never got up to as much as Steve was smoking when he smoked, but yeah, I did smoke.
Yeah.
And I quit September 14th, 2001.
About the time
It was right after
9/11.
Right after 9/11 and on my birthday.
Mm-hmm.
So thank you.
Yeah, that's pretty cool. Yeah, and of course I dipped Copenhagen like it was going out of style for years, but a lot of the cigarette. The smoking addiction to cigarettes and chewing tobacco for sure is just habitual. It's not the chemicals as much as the habituation.
Yeah.
So
yeah, that's right.
It's a three-legged stool, as you say.
That's
it's a three-legged stool.
Yeah, I used to say it was like a gig, like you go frog gigging, use a trident.
Yeah.
Because then the frog can't wriggle off of it. It's horrible.
Oh, gross!
Oh, no, it was awful.
Fast forward.
I never
listen. My dad took me. I was a kid. And you have the flashlight. Yeah, the silence of the frogs. It was awful.
Oh my God!
And I never missed.
Now I know what's wrong.
Never ever missed, and that I felt really bad about it. I still feel bad about it. And my dad would cut their legs off and then just throw them back in the water. And these poor frogs would be sitting there, and they're still alive, and they can't do anything. All they can do is just float there with their arms up, going, "What happened? Why is this happening to me?"
Oh.
It was awful. It was awful.
That's terrible.
No, I know. I wish my dad was still around. That's something I would fuss at him about.
Oh,
it was very traumatic, and the fact that I never missed made it worse because they didn't have a chance.
No.
But anyway,
Dead-eyed Steve.
Yeah. So, but it is three-pronged. There's the physical addiction, there's the habituation, and the psychological, addiction. And those last two are the hardest ones you can get over. I would be 6 weeks into it. My weakness was always 6 weeks and 6 months.
Mm-hmm.
So at 6 weeks, I'd be over the physical addiction. And I'd be working pretty hard on the habit, but the psychological aspect was still there. And then my ex-wife who was my wife at the time, piss me off. And then I probably because I found out that, I found the $1,200 phone bill, and then I'd go, well, by God, I'll show her. I'm going to go smoke a cigarette, and then I'd go smoke. And it's like, I'm not showing her anything. I'm showing her how weak I am. It was just the lizard part of my brain wanted me to smoke. Mm-hmm. And then 6 months, I would go, I've got this thing licked. I could just have one. And so I'd bum one off of somebody. And I'd be smoking again. So,
I was watching one of my movies, and they smoked the whole time yesterday. And it made me want one so bad.
Really?
And it's been...
I never want one.
I mean, I don't... It's been a long time.
20
years.
20 years.
When I quit, one of the things I told myself was that if I got a terminal illness, that I would smoke again. Because at that point, who gives a shit, right? But it's been so long now that I really feel like if I got a terminal illness, I wouldn't smoke. I don't have any desire anymore. I do dream about it, though. Do you ever dream about it, Tacie?
All the time. I dream about it.
All the time you do? Okay. I dream about once every 3 months. Mm-hmm. And I'll have a dream where I'm just smoking. And then I'll think to myself, in the dream, wait a minute, you dumbass, you don't smoke anymore. What are you doing? Now I'm going to have to quit again. And I wake up in a cold sweat going, thank God.
And that's funny.
Yeah.
So, and I've got a little bit more of a clarification on his question. He was just asking because...
Well, and I have something on flavonoids and addiction, too.
Oh, okay, cool. He was just talking about how nicotine replacement doesn't seem to help him with his addiction, which is, well, I'm glad we're talking about
flavonoid addiction, or flavonoid supplementation would help. That would be an interesting study, wouldn't it?
Yes, and
So let's ask him.
Behavioral therapy. Yeah.
How would we test something like that? Mm-hmm. That would be a very easy. So who is it in our room?
Mick KM.
Mick KM in the
chat room.
Waiting room.
Yeah.
So he has put forth a hypothesis, and the hypothesis is that nicotine replacement therapy by itself may not be as effective due to the action of flavonoids on the human body when smoking. So one way to test that would be, the good old double-blind placebo-controlled study. Give people nicotine patch, and then some people get a placebo, and some of them get some flavonoids oral supplement. You can buy them at Amazon. Mm-hmm. And you got to pick the right one, and then your endpoint would be successful lack of recidivism over a 6-month period.
Right on.
And you got to have a large enough group, and then at the end of it, you find out how many people went back to smoking, how many people stayed off, and which ones were on the flavonoid supplementation, which ones weren't, were on the placebo. And if there's a statistically significant difference, well, then your hypothesis has been reinforced.
Right on. Yeah.
So yeah, that's interesting. There is some research on flavonoids in addiction, and it has to do with the same receptor that Valium and Xanax and the rest of those attach to. Mm-hmm. So there are these gamma aminobutyric acid receptors. Don't worry about it. You hear of GABA. Mm-hmm. And benzodiazepines bind to these sites, and there are flavonoids that also bind to these same sites. So if they both bind to the same site, it follows that there may be some addictive potential of that of that molecule. It might help to explain some of the calm. People think that when they smoke, it calms them down. Mm-hmm. I always felt it was like you were just going through a mini withdrawal, and it just kind of ended that. But flavonoids in tobacco, now the next thing we got to go is he's sort of begging the question in the sense that his question has the answer in it already. Mm-hmm. That I don't know that tobacco smoke has a lot of flavonoids in it. I'm not aware of that. That's the next thing I got to go look at to see if that part of his hypothesis even makes sense. Maybe one of us can look.
And I'll look it up. And he was asking about the MAOIs too, but I've never heard of an MAOI effect on.
I have not either. And if that was truly an MAOI effect, but it's a monoamine oxidase inhibitor. Those are an old school version of class of antidepressants,
right.
And they had so many really serious adverse effects that they're very rarely written anymore. The adverse effects most of the time had to do with drug interactions. So interactions with cheese, interactions with wine, certain very, very commonly administered IV medications, stuff like that. So I'm looking up flavonoids in tobacco smoke. Who is this Mick guy? He's making me do a lot of work.
I know what he's making us work today.
All right. It just says here flavonoids are linked to lung cancer protection among smokers. So maybe they need to put flavonoids in tobacco smoke, but I'm not seeing a whole lot of that in here. But I'm not saying that there isn't. Oh, here we go. Tobacco, certain Nicotiana tabacum crops grown for smoke products as a source of bioactive compounds, including phenols and flavonoids. So there is some in there. So he was right. Interesting.
Yeah.
Probably not enough to protect you from cancer, though. But if you take an oral supplement, it looks like at least one study thought that there was something to it. All right. You got anything else?
I've got one more.
Go for it. This is one of those kinds of shows. It's fine.
And this
we're just talking.
This is pretty good. Okay, now I've got one for Dr. Steve. I had never heard of this diagnosis before.
Okay.
ARFID.
Yeah.
Avoidant restrictive food intake disorder.
Yeah.
I'd never heard of that. Okay.
That's picky eaters.
Very picky. So this British gal, 25 years old, has not eaten a fruit or vegetable in 22 years.
Yeah.
22 years.
I know all kinds of people like that.
She lives on chicken nuggets.
And French fries.
Yeah.
And
that's it.
Yeah.
I can't even. She turned down $1,300 from her uncle to eat a single pea.
Oh, come on.
No, that's what it says right here. Yeah, they interviewed her. That's crazy. That's the hell for $1,300. I think I could choke down a.
Yeah, and a lot of these kids are underweight, but it's because they're malnourished. And if you have one of these kids, you have to figure out some way to get some of these nutrients into them. Because, chicken nuggets, highly processed, they're protein, they got some stuff in them. But and then French fries, the skin is taken off, so you lose a lot of the nutrients from that. And then what was she drinking? Did it say what she drank?
No, just that she thinks it all started when she was 3 years old and was forced to eat mashed potatoes, and she didn't like it.
Yeah.
And has gone downhill from then. Yeah,
we really tried not to force our kids to eat stuff. And that when they were young, they ate everything. You remember that? And then all of a sudden they go to school and their friends go, "Ooh, vegetables, you're gross."
Now
and then all of a
pizza.
sudden then they wouldn't eat vegetables anymore.
Yep.
It's pizza every night.
Beck and Liam used to eat saag paneer at the Indian place.
Yeah.
Like it was going out of style.
Oh, that sounds good.
And then they started going to school and their friends started saying, "Oh, no, spinach is gross." And then that was it. I really feel like some of that was peer pressure.
No, it was. I feel like that too. Absolutely.
Damn kids.
There was no other reason for it.
Yeah.
They loved it.
Now let's talk about Tacie has avoidant restricted food issues with asparagus.
But that's just asparagus.
Well, tell
People
us
are like,
why.
"Oh,
though.
you love asparagus." I already have a weight problem. I don't need another food group. Do you understand what I'm saying?
Well, tell the listeners why you hate asparagus, which is it's the same reason I should hate asparagus.
Because my mother fed us canned asparagus growing up.
Have you ever seen that shit?
It looks awful.
And made me eat it.
It's just mush, and it's bright fluorescent green. It doesn't look like asparagus. Why would anybody do that?
And then I went and threw it up, and she did the same thing with chicken livers, which, in retrospect, come on now.
Ugh, gross.
And then I'd go throw it up.
Yeah. Chicken livers taste to me like I imagine a dry turd would taste.
Agreed. Yeah, I'm not a fan. I tried a bite of one time years ago, and it was awful.
I was at a party once, and they had here. I saw these bacon wrapped. It looked like beef medallion sort of things, beef tips. And I popped one in my mouth, and it was fucking liver. Now, who has that at a party in a chafing dish? Chunks of liver wrapped in bacon.
That's unbelievable.
I'm just going to let that sit there for a second. Just think about that. You're doing that to your friends.
Was it a highfalutin party?
It was a very highfalutin party. That made it even worse. Yeah. You should have good things.
Yeah, exactly. That's awful. Oh, my goodness.
Oh, no, yeah. That's the only time I put something in my mouth at a party, and I didn't, I spit it out into a napkin, and then I think I put it in like a planter or something. So the party was highfalutin. I wasn't.
Well, taught them a lesson when they found
That's
it.
right, by God. It'll teach you feeding me liver.
Oh, my goodness. Isn't that wild?
Yeah. But, my mom made me eat canned asparagus, too, so that's something that Tacie and I can relate to with each other on. But I like fresh asparagus now. I love it.
I love fresh asparagus.
I'll eat it all day long. But, and it is true, Tacie, cooked asparagus, canned asparagus, two completely different things. They're just different, but I'm not trying to convince you to eat it. I've given up on that, decades ago.
You'll love it. Just eat it.
Yeah, I don't do that. That's not me. That's not her Steve voice.
No.
All right. Yeah, that's a tough one. So our kids, when they became picky, they didn't have ARFID, but they became picky eaters. I started taking spinach, which is very tasteless when you masticate it. When you put it in a NutriBullet. Opie gave us a NutriBullet. And I started using the hell out of that, making smoothies for them, or just making spinach puree and putting it in the pizza sauce that I was making. I made their pizzas and stuff to somehow sneak those things in. And then now, of course, they've got multivitamins that are gummies. What kid isn't going to eat a gummy? You can get that stuff in them and get some fiber in them and just hold on and do the best you can. And if you, our kids have come around to being a little more adventurous in their eating. And, Beck will mostly eat anything now. Mm-hmm. Liam's still a little more restricted in his diet, but if I present vegetables to him, he'll eat them. No. I don't think he ever chooses to eat them. So.
Hey, Kim Chickens is talking about I always mispronounce it. Foie gras.
Yeah, foie gras.
I always mispronounce it.
What about it, though? The way that they make it. I'm not a big pita type, but it's disgusting. They take the geese and they shove a funnel down their throat and then just stuff them full of corn so that they get fatty liver. Liver. Yeah, they actually get fatty liver, and then they just eat their liver on crackers.
That's almost as bad as taking a frog and whacking off his two
legs. Dude, I'm not defending that. There's no part of me defends that. It was awful. It's a horrible traumatic memory for me.
I know it.
But it is. Yeah, it's just as bad. But why not just go get a turd and then put it on a cracker? I just don't understand it.
It's the same consistency and probably the flavor is similar.
Well, and stercobilinogen, which makes stool brown, comes from the liver. Bile comes from the liver. All those things that make shit what it is come from the liver, except for the food you eat and the bacteria in your stomach and your colon.
Oh, my word. Isn't that great?
So you're eating... Anyway, stop eating liver. It's disgusting.
It is gross.
Organ meats. I mean, if I'm starving... Yeah,
sure.
I'll eat it.
Yeah, I would never make it as a judge on like Iron Chef or something when they have
the secret ingredient, liver,
sheep brain.
Yes. No, thank you.
I'll be taking some of that asparagus out of the can over there, please.
Human scrotums.
Yes, human scrotums.
That would be a fun one.
Uh-oh.
Okay, so we just wasted an hour. You'll never get this hour back. Sorry, everybody.
Sorry.
Maybe there was something interesting in there. But I had a bad day, and that's just what... Now I have to make everybody suffer. Oh, but before we go, Kim Chickens had a question. She wanted to know what our stand is on functional medicine. So what do you think, Dr. Scott? Are you familiar with functional medicine?
I am. I think functional medicine can be very good if used appropriately.
Okay.
It's functional.
It's fine.
It is fine.
It's defined. Now, this is just a Wikipedia definition, so who knows was in there editing it. But it shows quite somebody's bias. It says functional medicine is a form of alternative medicine that encompasses a number of unproven and disproven methods and treatments.
Right.
Its proponents claim that it focuses on root causes of diseases based on interactions between the environment and the gastrointestinal, endocrine, and immune systems to develop individualized treatment plans. It's been described as pseudoscience, quackery, and at its essence, a rebranding of complementary and alternative medicine. So, listen, if it's a rebranding of complementary medicine, I don't have a whole lot of problem with it as long as you stay in your lane. Mm-hmm. It's when people start making absurd and insane claims that I have a problem with it. Dr. Scott practices, integrative medicine, mm-hmm. or do you ever use the complementary term, the C word?
I do, yeah.
Yeah. So Dr. Scott's practice complements what we do, and we complement what he does. And if I have a patient who can't, just doesn't improve with what Western medicine has to offer, I'll often send them to Dr. Scott. And as I've said many, many times on this show, if I don't have a diagnosis for them, he will have one. And it might be, they've got malaligned chi or whatever. Mm-hmm. But sometimes people just want to have a name for what they've got.
Yeah. Yep.
And when they do, they know they're not nuts. Mm-hmm. And, people, for the most part, just want to be recognized as human beings, and they want their problems heard and addressed.
Yep.
That guy in the mountains of, the South Pacific, that's the medicine man that shakes palm fronds over them, is fulfilling the same role that I fulfill if I were goofy enough to give somebody an antibiotic for a virus, and mm-hmm. that happens all the time.
All the time.
So, people want something for it. So if that's how you're defining this, I'm okay with it. If you want to fiddle with the definitions, I don't have a problem. But true complementary medicine, I don't have an issue with. Again, as long as you stay in your lane. We used to have a chiropractor on this show, and she's sadly no longer with us, and we loved her very much. But Dr. K was a very good chiropractor, and she knew that if she started giving people coffee enemas saying she was going to cure their cancer, that she'd be pilloried for it. Now, there are some places where you can get away with that. Mm-hmm. And she understood that all of us working together is way better than having people saying, well, those people are, don't know anything and they're no good, because you'll get the naturopaths doing that. You'll get some of the functional medicine people doing that, and you'll get some allopaths doing that as well. And I'm not one of those kinds of allopaths, but I do want, if you're going to make a claim for curing something, you better have some data to back you up, because
right.
I hold allopaths to the same standard.
Yep. Oh yeah, sure. Yeah, if you're making any kind of statements, you better be able to back them up.
Yeah. But so there's this guy, David Gorski, and I'm sure if Kim is a fan of functional medicine, she'll hate his guts. But this guy has written that the vagueness of functional medicine is a deliberative tactic that makes it impossible to challenge.
Mm-hmm.
But that in general, its practice centers on unnecessary and expensive testing procedures performed in the name of quote unquote holistic healthcare. So, look, do what you want to do, but just demand that they should at least be able to give you statistics on their outcomes before you spend a whole lot of money on it. Mm-hmm. And insurance won't pay for a lot of this stuff.
No.
So anyway.
No.
Okay, and there's no look. If you're doing functional medicine out there, God bless you. Just
do a great job.
Just tell the truth. That's the biggest thing.
Yep.
Okay, so one last thing. In 2014, the American Academy of Family Physicians withdrew granting course credits for functional medicine courses, having identified some of its treatments as harmful and dangerous. Wow. In 2018, it partly lifted the ban. Yeah, the Academy of Family Physicians, usually reasonably open to things like acupuncture and stuff like that. They're okay with it.
Yep.
And as a matter of fact, the president of the American Academy of Family Physicians was quite the alternative medicine proponent. And you and I both know him, so you know.
Yes, we do.
So the Academy itself are pretty liberal on this stuff. So when they go, this shit's dangerous, they're not screwing around. It says 2018 partly lifted the ban, but only to allow teaching an overview of functional medicine, not to teach its practice. So, all right.
Right on.
All right. There are centers for functional medicine at Cleveland Clinic and also at GW. So, you know, if you're interested in that, go there. All right. At least if something goes wrong, they've got people at both of those places that can come rescue you. Anyway, thanks always go to Dr. Scott. Thanks to Tacie. I don't know what camera I've had up this whole time. I completely forgot about the cameras. Oh well. Thanks, Tacie. You can. Yay. It's good to see you. And I will see you again in 5 minutes, and then the rest of the day tomorrow, and the day after that, and hopefully the day after that.
Okay.
On and on and on. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, that Gould girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Howdy Goo Plunk, Eric Nagel, the Port Charlotte Horror, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower.
Ooh, that's a new one.
I wrote that person will know who that is. Percy Dumb, Pocky U, Roland Campos, sister of Chris, Sam Roberts, she who owns pigs and snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's double, Steve Tucci, who we're going to be seeing in 2 weeks, right? The great Rob Bartlett, Vicks Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Deviated Septum, producer Chris, Jenny Jingles, the inimitable Vincent Paulino, everyone. Eric Zane, Bernie and Sid, Martha from Arkansas's daughter, Ron Bennington, and of course our dear departed friends, GVAC and Fez Watley, whose support of this show has never gone unappreciated. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand. All I can think of is the St. Pete Barkeep Blower. And other times at Jim McClure's pleasure. Tacie knows what I'm talking about. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. I wrote that at like 3 in the morning when I couldn't sleep. I totally forgot that I'd written it, so it took me by surprise. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Mess. And thank you, everybody. Good Lord.